Fungal diseases of the respiratory system. So, things to keep in mind when we think about these diseases. They're all possible because the spores of the molds that we're going to be talking about, which are 3, Histoplasma, Coccidioides immitis, and Pneumocystis jirovecii, the spores are spread by the wind. So you can inhale the spores even if you are not close to somebody that is infected. So it's usually just got contracted from the environment, not from another person. Okay? So it's an airborne disease. All these fungal respiratory diseases are airborne. So histoplasmosis is caused by Histoplasma capsularum, and that's a dimorphic fungus. What does that mean? It's a mold at lower temperatures, like 25 Celsius, which is room temperature, and at 37 degrees, which is body temperature, they're usually in the form of yeast. Okay? So this yeast, which is unicellular, grow inside macrophages. So once the person inhales the Histoplasma fungus or their spores, they can accommodate lung, lymph, and blood. Usually, they form these lung lesions, and 0.1% of the cases become severe, generalized disease. Okay? These macroconidia are some structures that are very typical to be seen in the mold. Okay? And they are usually useful for diagnostic purposes because they can be seen in the tissues too. Okay? So because they're dimorphic, they can change their form to macroconidia in the body, even though it's not their preferential temperature. It's common to see Histoplasma in Ohio, Mississippi, in the Mississippi River Valley, and also in Central and South America, Africa, Asia, and Australia. And all these respiratory diseases caused by fungi are most likely caused in people that have an immune-compromised system. So if their immune system is weak, like if they have AIDS, or if they're doing chemotherapy, or if they have any pre-existing condition that weakens the immune system, they're going to be more prone to catch it. Okay? One way to be around more Histoplasma is to be in contact with bird and bat droppings. Bird, because the Histoplasma likes the nitrogen from the bird droppings. Remember, there's a lot of nitrogen in their droppings, and they end up growing there. And in the bat, because the bat is the carrier, so the droppings from bats have Histoplasma because the Histoplasma is inside the body bat. Okay? It's not the case for birds. Birds are not carrier. They're just growing in that dropping. Okay? That like fell on the floor. And then the spores can be spread, right? Coccidioidomycosis. This is a disease also known as valley fever or San Joaquin fever, because that's where you had an outbreak in San Joaquin in California. They're caused by Coccidioides immitis. That's another dimorphic fungus. The arthroconidia, or that part of the mold where the spores are usually found in the American Southwest. Most infections are not apparent, but you can see fever, coughing, and weight loss in the cases that are symptomatic. You also have symptoms like headache, night sweats, muscle ache, joint pain, rash on upper body and leg, and this is how the rash, the erythema nodosum, looks like. And it can be severe in 5 to 10% of people who get valley fever, and long-term problems in the lungs after that. The infection can spread also from the lungs to other parts of the body, like central nervous system, skin, bones, and joints. This is how the cycle of this fungus happen. So in the soil you have the artroconidium, it germinates, it forms a hypha. These hyphae are split, separated, and airborne artroconidium can be inhaled. So you see, what you really inhale in the case of this disease is not even the spore, it's the artroconidium. It's like a part of the hypha. And then those inhaled artroconidium will enlarge, become a sphere, and this little sphere, they develop into endospores, and then those endospores grow inside the spheres, and then they're released. When the endospores are released, then they can develop into a new little sphere and close the cycle, and they continue to happen. Okay, like close here, right? And then a new spiral makes more endospore, and then they're spread out. So even though you're inhaling the artroconidium, the spores are growing inside the human body, if that makes sense. You see, all the arrow, or all the orange arrow parts here are in the human body. This is what it looks like in the tissue, where you have the sphere full of endospores inside. And this is how the artroconidium looks like. Next and last disease, pneumocystis pneumonia, caused by Pneumocystis jirovecii, and this fungus sometimes is confused with a protozoan because the way they grow looks like protozoan. Look at that. Let me show you. See, that's how they look. So because they have a type of structure that looks like a cyst, so this is a cyst with all these little bodies inside, and this cyst ruptures and releases these little bodies, which are considered to be trophozoites, right? So that's what you see usually in protozoa, right? And then the trophozoites grow and mature into a new cyst, make more trophozoite, and that's how they keep proliferating. Okay, you see these cysts full of trophozoite inside in the lungs. This disease is usually asymptomatic, but in immunocompromised patients, then it can become symptomatic and manifest itself. Primary indicator of AIDS. Most of patients with AIDS have pneumocystis pneumonia. What else I wanted to tell you? Serological evidence indicates that most healthy children have been exposed to pneumocystis by age 3 or 4. It is considered a fungus because of nucleic acid and biochemical analysis. Okay, that's why they say this is not a protozoan, but it's a fungus. The symptoms of this disease include dyspnea, non-productive cough, and fever. Okay, and in the chest radiography, you can see the bilateral infiltrates. Usually when you have lung infections by fungi, you can see infiltrates on both sides. Okay, the extrapulmonary lesions occur in a very small percentage, like 3% of the patients, and usually are in lymph nodes and spleen and bone marrow. If it's untreated, the progression of this disease can lead to death. Okay, so again, just mostly in immunocompromised patients. All right, we are done, and I will see you when we talk about the next chapter, which is about the digestive system. Bye-bye.